So I am actually from Liverpool, and I grew up not far from Aintree Racecourse, where it's famous for the Grand National. I originally was interested in art and design, but I realised it wasn't really for me. I went into an administrative role for neurology and neurosurgery, and I used to watch the nurses, and I was really drawn to their role and the impact that they had. They were really there to support people at sometimes the most incredibly difficult periods of their lives. The way that they communicated, the way that they truly did care, and it was almost like they were putting themselves in the individual shoes. And I felt that I would be very well suited to that particular role. So I used to do my Monday to Friday in administration, and then at weekends I would be working in a different capacity as a nurse on the wards, and the rest is history really. So when I finished my undergraduate degree, I worked in the acute medical admissions unit, which was very fast-paced. I moved into cardiology actually after that, and worked in coronary care, and then I became a nurse practitioner and worked in both the community and acute hospital. And when I moved over to Ireland, I was very interested in advanced practice, and being able to really develop the advanced nurse practitioner role. I really felt that RCSI gave me that flexibility and opportunity. So I completed my Masters in Nursing Science in the Royal College of Surgeons Ireland, and then ultimately I went back to complete my PhD. So Community Virtual Ward, in essence what you're trying to do is emulate aspects of hospital care in the home. We're really driving towards bringing care closer to home and offering patients that choice, that they don't necessarily need to go into hospital to access care during critical periods of illness and functional decline. My role is to support the chief nurse in identifying gaps in policy and strategy, and really working with frontline services then to look at how policy can enable them to provide technical advice and support to other departments, and work across agencies and with the health service executive. And so it's very diverse and very broad-based. There's the policy element, there's the technical advice, but it was very much driven by frontline services. So it was enabling them to be innovative and creative, and then just being able to define what the principles were so we can scale this type of approach. My whole career has been around design and innovation, and I do enjoy, if there's a problem or there's an area of care that we need to develop on, and being creative of how we can lead on innovation, but really enabling others to do so. So what I'd like to be in a position to do is use the expertise that I've developed over the years and be able to support others, especially frontline services, to do the same. It is a privilege to work in this particular role, and I always go back to what would I want one of my family members to be treated, in what way, and I try to mirror that then in everything that I do. But I always say go back to your values and start from there, and they do guide you, definitely.